সুপ্রিয় দর্শক, আপনাদের সবাইকে আমন্ত্রণ জানাচ্ছি এটিএন বাংলার বিশেষ স্বাস্থ্য বিষয়ক আয়োজন অ্যাস্টার হসপিটাল ব্যাঙ্গালোর ইন্ডিয়া নিবেদিত স্বাস্থ্য বার্তা অনুষ্ঠানে। আপনাদের সাথে আছি আমি ডাক্তার ফাতিহা শাফি, আর থাকছি অনুষ্ঠানের পুরোটা সময় জুড়ে। দর্শক, আজ আমরা অত্যন্ত গুরুত্বপূর্ণ একটি বিষয় নিয়ে আলোচনা করতে যাচ্ছি। আমি একটি বলবো না, আমরা আজ দুটি বিষয় নিয়ে আলোচনা করতে যাচ্ছি। সেটি হচ্ছে মস্তিষ্ক এবং কিডনিকে নিয়ে জানুন অ্যাস্টার হসপিটালের সাথে। আর এ বিষয় নিয়ে কথা বলার জন্য আমাদের সাথে স্টুডিওতে দুজন স্বনামধন্য চিকিৎসক উপস্থিত আছেন। আমাদের সাথে আছেন ডক্টর রবি গোপাল ভার্মা, ডিরেক্টর অ্যাস্টার গ্লোবাল ইনস্টিটিউট অফ নিউরোসায়েন্সেস অ্যান্ড লিড কনসালটেন্ট নিউরোসার্জারি, যিনি 25 বছরের অধিক সময় সফলতার সাথে এপিলেপসি, মুভমেন্ট ডিসঅর্ডার অ্যান্ড ক্রনিক পেইন ম্যানেজমেন্ট করে আসছেন। এছাড়া তিনি অত্যন্ত দক্ষতার সাথে নিউরোসার্জারির যেসব শাখা আছে, পেডিয়াট্রিক, ভাস্কুলার এবং এন্ডোস্কোপি ক্ষেত্রেও চিকিৎসা দিয়ে আসছেন। স্যার, আপনাকে আমাদের অনুষ্ঠানে স্বাগত জানাচ্ছি। এবং আমাদের সাথে আরও আছেন ডক্টর সুন্দর শঙ্করন, প্রোগ্রাম ডিরেক্টর অ্যাস্টার ইনস্টিটিউট অফ রেনাল ট্রান্সপ্ল্যান্টেশন, অ্যাস্টার হোয়াইটফিল্ড হসপিটাল, যিনি সফলতার সহিত 3000-এরও অধিক কিডনি ট্রান্সপ্ল্যান্ট করেছেন। বাংলাদেশেও এর সংখ্যা 500-র অধিক। এছাড়াও জটিল কিডনি প্রতিস্থাপন, প্যালিয়েটিভ নেফ্রোলজি, জেরিয়াটিক কিডনি ট্রান্সপ্ল্যান্টের ক্ষেত্রে তিনি দক্ষতার ছাপ রেখেছেন। স্যার, ওয়েলকাম টু আওয়ার শো।
Thank you.
First of all, I would like to ask Ravi sir, what is epilepsy? How can we define epilepsy to our general patient?
A short circuiting that happens in the brain,
Okay.
resulting in violent movements of the hand, loss of consciousness, and sometimes a violent stare, just a small stare like that.
Okay.
So it has variety of presentations. So it's basically because there's some short circuiting that happens within the brain.
Okay. So, what are the main causes of epilepsy? Is
Yeah.
there any signs or symptoms of that?
So one of the most common causes, it's called idiopathic epilepsy. That means they can have seizures from childhood. They can have seizures. Seizures is the word we use for epilepsy. And it can be also as a reason or a cause of tumors. Tumors can produce epilepsy. Sometimes even if there are metabolic problems, that is reduced sugar, reduced salt in the blood, it can lead to a seizure event. But epilepsy is a syndrome, and that is a disease which can be treated, and in certain instances it can be cured.
Oh, it can be cured. We are coming to you next.
Yeah.
Sir, I would like to ask you something. Kidney is a very vital organ in our body. So, how can we define kidney actually? What is kidney?
Kidneys are bean-shaped organs. We have two kidneys provided by God. 1 in 1,000 has got only one kidney. The function of the kidney is to purify blood, but apart from that, it's got many other functions to keep life going on. So basically, it is God's gift to say that we have got two kidneys, and 1 in 1,000 is born with one kidney, which is very important to know for the purpose of kidney transplant and others.
What is the symptoms are there behind the kidney damage? Can you please explain it to our viewers?
There are many symptoms. The kidney disease is a silent killer.
Okay.
Most of the time you don't have symptoms. The only way you diagnose is by doing blood tests. But there are certain warning signs, we can say. When you get up in the morning, there is swelling around the face, or we call puffiness of face, swelling on the feet,
Okay.
or you're passing less urine. Passing more urine also important. People think that if I'm passing more urine, there's no kidney problem. So in kidney failure, you cannot pass more urine, passing blood in the urine, pain while passing urine, stones while passing urine, burning urine, high blood pressure. Anybody who's got high blood pressure or hypertension, they have to get their kidneys checked. So these are some of the important warning signs for kidney disease.
Okay. All know about the thing like dialysis. So, what is dialysis actually? Can you please brief us?
Once you have kidney failure, there are two types of kidney failure. One is called temporary kidney failure, and other is a permanent kidney failure. So in both types, when the kidney failure is advanced, where life cannot go on, we can do what is called dialysis. Dialysis is actually a process where we are purifying the blood. As I said earlier, the function of the kidney is to purify blood. So when the kidney is not functioning, this procedure of purifying the blood can be done by what is called dialysis, where we take the blood out in a machine and we use an artificial filter which will clean the blood and the blood is returned. So this is a simple process called dialysis, which is life-saving.
Is there any duration for dialysis?
It's an excellent question, because once you have permanent kidney failure, you have to be either on dialysis permanently or go for a kidney transplant. Now, once we say dialysis, a lot of people ask, whether one dialysis, two dialysis. No, once you got permanent kidney failure, we have to be on lifelong dialysis. Normally, it is 4 hours each session, 2 to 3 times a week, roughly about 12 hours a week, lifelong. So it goes on alternate day more or less, and it is lifelong, or till you go for kidney transplantation. So if somebody has got a kidney donor, we can do the transplant early. So dialysis may be in a month or 2, or some of them will not have donors. I've got patients who are on dialysis for the last 25 years. So that is the way it is.
Okay, sir. Dr. Ravi, sir. Sir, how can we detect epileptic patient? What do you say?
So once a patient has a seizure, that's a manifestation of epilepsy, we do something called an EEG. And that EEG will pick up the electrical mismanagement in the brain. It picks it up. It's called electroencephalogram. So once that is done, we can, sometimes the electroencephalogram may not show anything.
Okay.
So we need to do that same test when the seizure is happening. So it can precisely tell where the problem is, which part of the brain there is a short circuit, and why is it spreading across. We should be able to make out.
Okay. As you are a neurosurgeon,
Yeah.
so I would like to know from you that there is a conception like that epilepsy cannot be cured. So what do you want to tell us about that?
So most of the epilepsy, that is about around 70 to 80% of epilepsy, cannot be cured. When I say cured, means it can be controlled. It cannot be cured with medication. You have to continue medication. But sometimes there is a 10 to 15% where it can be cured completely. For example, if there is a small circuit mismatch in the brain, and that is picked up in EEG and picked up on an MRI and picked up on a video EEG, then we can remove that part.
Okay.
When we remove the part, it's a cure. It's a total cure. So epilepsy otherwise is a lifelong, like hypertension, like diabetes. You have to give medication to control the epilepsy. They can work together, but when the epilepsy is controlled by 2 or 3 drugs, sometimes the drug side effects are more. So that is when again it can affect the individual. But if you remove it and the seizure focus is taken out, epilepsy focus is taken out, it's cured. So there is a good 15 to 20% that we can cure. So they have to get evaluated whether it's a curable or a not curable situation.
That was a very nice explanation.
Because everyone thinks it's not curable, but there is a good 10-15%, and those 10-15% are completely cured. They don't have to take medications. They are labeled as non-epileptic, which is a big thing in society.
Okay. That's a nice explanation, sir. Sir, now I would like to hear from you that we are all know about that kidney transplantation. So what is actually it is? We don't have a clear conception about that. Can you please tell us?
See, once you have, as I said earlier, permanent kidney failure, life cannot go on without what is called replacing the kidney function, either by dialysis and go for kidney transplant. Kidney transplant involves taking a kidney out and then putting it in the patient with kidney failure. So basically in the kidney transplant surgery, there is a donor who is a live donor. It could be a family member or a friend, or the kidney could come from what is called as cadaver donor, or we call them brain dead heart beating donor. So whenever I say cadaver donor, people think that you can take the kidney from any dead body. No, it's not like that. A person who has a brain death, commonly the brain death occurs after a road accident, somebody going in a motorcycle without a helmet, or in a car accident, or somebody who has a stroke or bleeding in the brain, and their brain is certified dead, brain dead, by a neurosurgeon colleague like Dr. Ravi Gopal Verma's team would certify the brain is dead, and then we can take the organs. That is, one is the kidney. In a brain dead person, a person can actually save 8 lives, 2 kidneys, liver, heart, lung, pancreas, like that they can do that. In a live donor transplant, a person who is mostly family member or a friend can donate a kidney, because as I said earlier, 1 in 1,000 is born with 1 kidney. So that's God's way of telling you that you can donate kidney safely. So in kidney transplant, the operation goes on simultaneously in 2 theaters. In one theater, the kidney will be removed and then it is taken out, cooled, and then in the patient with kidney failure, the kidney is put in. Another important thing to note is a lot of people ask me whether the old kidney which is damaged, whether it's removed. Normally, we don't remove the old kidneys. The new kidney is put on the right side of the lower part of the abdomen or on the left side, and the transplant is done. That's the way it is.
Can you please brief us about the details of kidney transplantation?
So
I want to know about the procedure.
Basically, when you decide on kidney transplant, first we have to do the donor test. The donor test involves a lot of blood tests because we must find out the person who is donating. Nothing should happen to that person, him or he or she, after even many years. So we do a lot of tests. Then we do something called an angiogram for the donor, because that is like a roadmap for the surgeon to remove the kidney. Once that is done, we do what is called a cross-match test, where we mix the donor's blood with the patient's blood and see whether the body will accept the kidney. And that is done. The transplant date is fixed, and it is done in the 2 theaters, as I said, where the kidney is taken out by one team of surgeons, and then it is cooled and then put into the patient's body. So, but the patient also has to be evaluated before they go for kidney transplant, because somebody with a heart problem, they have to see that the heart problem is settled, or some other lung problem, it has to be settled. So it's a teamwork. So transplant is not one person, it's a team of doctors, nurses, technicians. It involves a lot of people. It's a teamwork.
Okay, thank you, sir. Sir, now you have already told us that epilepsy can be cured in some cases. So, can you please tell us that what is the actual process to cure it?
Yeah, that's a nice question. So, one is we do what's MRI. Nowadays, the MRI has become so good. There are good softwares with MRI where we can detect areas in the brain which are abnormal. In the past, we couldn't detect. Now there are very beautiful images where a neuroradiologist can pick up and tell, look, this area does not look normal. So then what we do, then we put in electrodes into that area and then take a video and have the seizure.
Okay.
So when the electrode which is there inside gets stimulated, we know that is the area where seizure starts. Not anywhere else in the brain, because seizures can start in a millisecond and spread all over the brain. But where it starts is where, because if we remove some other place, with starting place, if we don't remove, no effect. So that's called a stereo EEG. So we do that EEG where we put in electrodes, see that area that is causing the problem, open the skull and remove that specific area. And when we are removing, we put a grid, like we do the EEG, we do intraoperative EEG. And once we remove it, we'll see the EEG is normal. Then we know that we have removed that area and he is seizure free.
Okay, so this is all about a surgical procedure.
Surgical procedure.
Okay, is there any age limit to do this surgery?
Yeah, so absolutely no age. I have operated on a 2-year-old child where we have put a device and then prevented surgeries, prevented epilepsy. Because the earlier you prevent epilepsy, earlier you prevent seizures, the better is the brain development.
Okay.
So children, pediatric epilepsy surgery is a very, very common thing. Now the awareness is becoming more. So we evaluate a child with epilepsy much earlier than in the past, when we used to say, no, we'll wait for it to improve. Let's wait till adolescence, let's wait till adulthood. So more you wait, more the brain gets damaged, more you are not going to give cure. So earlier the better. Before the child gets psychologically affected by the seizures, you remove the thing. And the children are much better candidates for surgery than adults. Unlike the popular thought where children you can't operate. That's not the truth. They're much better. They recover much better, they heal much better.
Okay.
And elderly, we have operated at 60, 50, all if we find a focus late, because it's an evolving science. So now we have found out in even a 50-year-old or a 60-year-old gentleman that is a focus. We remove the focus because they live nowadays till 100 years. So the next 40 years can be comfortable for them without seizures.
Okay. Okay, sir, now I'm coming to you. Is it safe to transplant kidneys? What would you say?
It's a good question, because a lot of people ask what is the guarantee after kidney transplant. I would always say that when you have, as I said, permanent kidney failure, either it is dialysis or transplant. When you take 100 people on dialysis today, at the end of 10 years, 90 are dead, even in a country like America or Japan where the dialysis is very advanced. With a transplant, do 100 transplant today, at the end of 10 years, 90 are alive. That means the longevity is much better with a transplant. Same with quality of life. So if somebody on dialysis, I told you this 2 or 3 times a week, they can't take more than 500 ml of water or fluid per day. When I say water, it is not just plain water. Your coffee, tea, dal, whatever it is. You can't take more than half a liter per day. So, and then again, they have to travel somewhere. They may not have the dialysis machines. So planning becomes difficult. The quality of life, whether it's married life or doing work on dialysis, is not as good as transplant. See, you must understand that God's creation, the kidneys work 24 hours. Whereas with dialysis, even if I do daily dialysis, it is not even 10%. So nothing like a successful kidney transplant. But are there problems? Yes, there are problems. Because a person who's had kidney transplant is on drugs which is called immunosuppressive drugs. The immunity comes down. You know, like in COVID, because of the immunity was low, we lost quite a few transplant patients. In fact, 1 or 2 of my transplant recipients in Bangladesh have passed away because of COVID, because their immunity was low, because they are on these powerful drugs which is lifelong. So that is another problem. It's a cost, because these medicines are expensive and they can't stop even one dose. When they are on these transplant medicines, they cannot even miss one dose. If they miss, they may have rejection. So one is body not accepting the kidney because of rejection. Other is infection, because the medicines, they can have infection. So this is the problem in transplant. But at the same time, we can't say who will have this problem, who will not have. They have to take the risk. It is like marriage, I keep saying. It's a risk which you have to take. And overall, the science has evolved so much. Now we are able to diagnose infection faster. We've got better antibiotics. So things have changed. The quality of life and success of transplant has changed enormously in the last 30, 40 years which I have been in this field.
Okay, sir. Sir, you are talking about surgery. So is it safe to doing epileptic surgery?
So definitely it's safe. Moment somebody says brain surgery, all are upset. They say, oh my God, brain out. And then when we tell we're going to take part of the brain out, they're even more scared. But it is the defective part that we are taking out. And because of the advanced technology, advanced surgical equipment that we have called navigation and MR guidance, with all these things, it's very, very safe to remove that particular affected part. Now there are certain areas which are multiple. So we can't remove every part of the brain. For such patients, we have got called palliative surgery, where we stimulate the brain, one with either DBS, deep brain stimulation, or we put a vagal nerve stimulation. All these, what happens when the seizure starts, it stops it. So it's not curing it, but it's controlling like medication. But medication has got a side effect this doesn't have. So therefore, generally, all surgeries for epilepsy are very, very safe. It is as safe as me traveling back to India by flight. Something can happen, but we all travel. So it's a rare event that something might happen. But it is as safe as that.
Okay. Sir, in kidney transplantation, what precautions should we take?
Basically, as I said, because all these transplant patients are on these powerful drugs, which reduces your immunity. What is immunity? Immunity is the body's mechanism to fight an infection. So when the immunity is suppressed, they are prone for infection. So basically, this first few months after transplant, they are on high dose of these drugs. So the immunity is low, so they have to be careful. They have to follow good hygiene. So basically, I think COVID has taught us that. Wearing a mask in crowd, cleaning your hand sanitization, cleaning your food, cooked food. These are basic precautions which should be taken by everybody. In transplant, because their immunity is low because of these medicines, they have to be careful. And the other thing is correct follow-up. See, these transplant patients are married to us lifelong. So when they have transplant, the first 3 months, they are coming to me twice a week with all the blood tests like that. The next three months, they are coming once a week, then once in 2 weeks, then once a month for a year, and once in 3 months lifelong. So this follow-up is very important. If they miss the follow-up, then the success of transplant also comes down. This is the problem which we have in India and in Bangladesh, because one of the cost, because they have to travel somewhere to see the kidney specialist, then the cost of medications. So that's why our success compared to other countries, not because we have bad doctors, it's because the patients cannot access good care. So that's where I think we have to educate them. I think a program like this is very important to tell the people that after transplant, please have correct follow-up, see the doctor correctly, take the medicines, and you will do well.
Okay, thank you, sir. Sir, what is the actual success rate of epileptic surgery?
Okay, very good question. Because it's very important, first of all, to select the correct case. So there are cases that if wrongly selected and wrongly operated, it's not going to help. But if it's correctly selected, and if the epileptologist and the epilepsy surgeon both concur and agree on the point, then it's very successful. 80 to 90% we have success. And imagine taking lifelong medications and suddenly you stop those medications. So it's a very, very effective and very, very good procedure, and more it's being evolved now, and I think the success rate is on the upward trend. So we have come to nearly 90-95% of success.
That's a massive percentage.
Yeah.
Okay, sir, now I'm coming to you. What happens to the donor when he transplants his kidney to another one?
Actually, it's a very good question, because the concept of kidney transplant came in because people knew that 1 in 1,000 is born with kidney. So they knew that. Then later on, what happened was one of the kidneys was removed because of some infection or stone, and people lived normally. But the most important thing is, before the kidney donation, the donor should be evaluated properly. So when it involves medical test, it also involves psychiatric test, because we have seen donors who donated and then they are upset. So psychiatric clearance, so that we know the donor is donating out of pure affection and there is no commercial transaction. That is most important. So these are, one is that is medical. Then we have legal issues, because every other day you keep seeing in the papers somebody went to some hospital, kidney was stolen, these sort of news come in. So legally you have to be very safe. So you need a good legal team apart from medical team to take care. But basically I would say kidney donation is safe with proper evaluation, done in a good center. That is the most important thing. Done as experienced center, they evaluate the donor. And the question now also comes about age. What is the age group? See, my oldest donor has been 80 years old. He donated, a grandfather donated grandson. So these are all, age per se is not a problem, but good evaluation in a good center is most important for long-term success.
Okay, so you all know about one thing. There is a proverb like prevention is better than cure. So what is the preventive measure should we take to prevent kidney failure?
I think, see, if you look at my experience in the last 40 years, 50% of my patients on dialysis or transplant are due to diabetes, high blood sugar. So basically, if somebody is diabetic, controlling blood sugar is very important. So even otherwise, somebody having good blood sugar control, blood pressure control. So somebody who got high blood pressure from childhood, you have to investigate, control the blood pressure. So in the bargain, what happens is, what we are now saying, salt is one of the causes of increased blood pressure.
Okay.
In fact, now we are saying, apart from sugar, less. Like in Hindi we say chini kam, like less of sugar. Same way, less of salt. That is important. Then lifestyle modification. See, our fast foods now, thanks to McDonald's and the fried food, all that is adding to children having more salt, and then blood pressure going up, kidney getting damaged.
Okay.
So then
salt should be avoided.
Yes. And then other thing is exercise.
Okay.
You gain weight, obesity, that is another cause. So exercise is very important. Then other most important thing is smoking. Now we see a lot of people, and I see even in India and other places, even women have started smoking, which is not a good sign, because it will affect the kidney. So if somebody is to prevent kidney disease, no smoking, definitely less of salt, lifestyle modification, sugar control. Other thing is stress. It's very important. Stress also adds to the problem of kidney disease, because hypertension, stress. So I always say stress should be avoided.
Okay.
And I keep saying smile. If you smile, the kidneys will smile.
Okay.
And proper evaluation. If you have some symptoms which I told you, immediately check the doctor, get your urine test, get a blood test called serum creatinine, which is called the kidney number, and then can find out kidney problem and you can prevent kidney disease.
Okay.
I think it's very important.
That's a very nice explanation, Dr. Sundar sir. Sir, we are at the last moment of our programs. Would you like to tell something to our viewers?
Most important thing, if there is epilepsy, if any patients have epilepsy, since we are on that topic, please get it evaluated. Because if you fall in the 10 to 15% which can be curable, it's a life-changing situation. So please get evaluated, see that it is whether it's curable or not, or whether controllable, then go ahead. Because the percentage, as I told you, is 15, is going to increase, because more and more epilepsy is going to be curable. And so the most important thing is to see a correct person, an epileptologist and an epilepsy surgeon, to get a proper outcome. It's very, very important.
Sir, now here is your time.
I think as a kidney transplant surgeon, my message to everybody is, because the way kidney failure is increasing and there is organ shortage, I would say be an organ donor. God has given you 2 kidneys, please pledge 1 kidney to your loved ones, or after you have brain death, please donate your kidney, because be a hero. And we keep saying, I love you with all my heart, but you can't, when you're alive, you can't donate your heart. But when you're alive, you can donate one kidney. So I will say, I love you with all my kidney. That's my message.
Thank you so much, sir, for coming to our show, and thanks for your precious time. We have learned a lot of things from you about kidney and epilepsy. Thank you so much once again.
Thank you. Thank you.
দর্শক, আপনাদেরও অনেক অনেক ধন্যবাদ আমাদের সাথে এতক্ষণ থাকার জন্য। আমি জানি এই অনুষ্ঠানের মাধ্যমে আপনারা কিডনি এবং মস্তিষ্কর বিষয়ে নানা দিক জানতে পেরেছেন। আপনাদের সবার জন্য থাকলো অনেক অনেক শুভকামনা। সবাই ভালো থাকবেন, সুস্থ থাকবেন, এটিএন বাংলার সাথেই থাকবেন।